We're joined by Dr. Stenehjem to give our monthly COVID-19 update on what's been happening in the state of Utah since the last time we spoke. If you haven't noticed, we have decreased the amount of times we are doing this because everything is starting to go back to a decent normal of 2019. So as always, though, we will start with our case trends of what's been happening. Yesterday's numbers are the numbers I will be reporting. The total COVID cases in the state of Utah are at 408,741. Yesterday's case counts were at 313 and one death was reported. Our hospitalizations yesterday were at 155. And as far as vaccines go, the amount of Utahns who received the first dose is at 1.5 million, and those who are fully vaccinated are at 1.2 million. That makes the percentage of Utahns who are 12 plus, which is the current eligible population, at 49.1% fully vaccinated. Let's start with that. How are we doing? What do these case numbers mean? And are we going up from here or getting better from here, I should say, not going up?
Yeah, I mean, wow, like what a difference the past few months have made. And we are in a really good spot. I say that from both the United States and also Utah perspective, is that if you look at both national trends and also local trends, you've seen just a precipitous decline in cases, which is remarkable. And, you know, that definitely is tied to a lot of things, but, you know, predominantly that's due to widespread vaccination across the US and also here in Utah. And so we are in a good spot. And then, you know, as a community, we're relaxing some of the restrictions that were in place, which is appropriate based on vaccination status and based on our case trends. And so, you know, we're definitely not out of the woods. And there's going to continue to be cases of COVID-19 and severe cases, and in some instances, death, especially in the population that have chosen not to get vaccinated. We have seen a little bit of an uptick since Memorial Day. And in my mind, Memorial Day was kind of the inflection point of where you really saw a lot of people stop and wearing masks. You saw a lot more people out engaging in the community. In my mind, that's really kind of where things changed, you know, pretty abruptly. And we have seen cases come up a little bit. We've seen a little uptick in hospitalizations if you look at the Utah Department of Health data, but not nearly the spike or the surge that we saw, you know, after Halloween or after the, you know, Christmas, New Year's holiday. So we are in a good spot, but, you know, for those that haven't been vaccinated or at our high risk and didn't necessarily respond to a vaccine, you know, COVID-19 is still in our communities. COVID-19 is still a present danger and could result in severe illness.
Are we seeing any outbreaks anywhere of cases that are concerning at all in the US or even abroad?
Yeah, I mean, putting the discussion about global cases of COVID-19 on the back burner just for a second and talk here locally, you don't have to look that far to see outbreaks. You know, just actually an outbreak in our neighbor in Colorado in Mesa County. Mesa County is where Grand Junction is. It's where Fruita is, a really popular destination spot for outdoor recreation. We actually were just there about a month ago to ride bikes. And what we're seeing there is a continued rise in cases of COVID-19, and to the point now where their hospital is on divert, they're holding off on elective surgeries, and their hospital's full. And if you look at the vaccination rate of Mesa County, it's 39%. Fully vaccinated 12 and up, compared to ours, which is 50%. And so you definitely are seeing and will continue to see pockets and outbreaks of COVID-19 in those communities that are not highly vaccinated. And that'll happen here in Utah. Absolutely, we'll see it amongst small communities where we have an outbreak because COVID-19 is present in our communities, and it will find those susceptible populations to be able to, you know, cause disease and spread disease. And so I anticipate that we'll continue to see that here in Utah and also in, you know, our neighboring states, especially in areas where we don't have that high vaccination rate. The other thing that we're contending with are new variants. And so we know that the variants that, you know, originated, some in UK, some out of India, South Africa, Brazil, they're more transmissible. And so it's easier for them to spread. And some of them can cause more severe disease. The good thing is right now, they're all covered by the vaccine, and they provide some certainly effective prevention, but they are very transmissible, so they will be able to spread through those susceptible communities. Globally, different story altogether. We have to recognize how fortunate we are here in the US to have access to vaccinations, which is not uniform across the globe. And so we just saw this big surge in India. We saw a surge in Japan, which is potentially going to impact the Olympics this summer. Nepal had a big surge, and now we're seeing a lot of surges in South America, Colombia and Chile and Brazil. And so, we are definitely going to be seeing continued global surges. And, many people are like, well, that doesn't affect me. That doesn't affect us. In reality, it does, because when you have high rates of transmission, that's when you get viral variants forming. And we've seen with the B117 variant, and now with the B1617 or this Indian variant, that comes to us. That comes to the US very quickly and can spread very quickly across the US. And so if there was a variant that wasn't protected by the vaccine that is generated in a country that has high rates of transmission, that is very quickly going to be our problem as well.
Let's talk a little bit more about the vaccines. The first thing I want to talk about in relation to those variants is booster shots. We've heard a little bit about them in the news and reports a couple of months ago about maybe needing them. Do we have any more data or information around if we do need them and when we could get them potentially?
Right. And we've talked a little bit about this before, but when you think about boosters, there's two indications for a booster shot. The first indication is when immunity starts to wane. So over time, and this is normal for people's immune system, is that your immunity to a virus or a bacteria will wane over time. And so if you get a vaccination, the farther away you get from the vaccination, the more that your immunity starts to wane. You can combat that with a booster. And so you give a booster and that immunity goes back up. And then that lasts for another duration of period. Think of tetanus shots. That's the reason we get a tetanus shot every 10 years is to boost the immunity. Okay. So that's one indication of when to get a booster. The other indication to get a booster is actually to generate new immunity. And so this is where you think about viral variants. And so if a variant came that our current vaccine didn't cover, that would be an indication for a booster. But in reality, that's actually a new vaccine to cover, a viral variant. This is what happens with influenza. And so the reason we get an influenza vaccine every year is to make sure that the vaccine we're getting is going to cover the virus that's circulating. Okay, so those are the two indications to get another shot, either waning immunity or a new viral variant. So right now, we don't know how long vaccine immunity or natural immunity lasts. And so right now it's all speculative. And so if you hear people saying, oh, we're going to need it by the fall, or oh, we're going to need it by the winter, they're speculative. We do not know when immunity really starts to lapse and when we'll need that kind of extra shot to boost our immunity. The way we're going to see this and know when we need it is when our vaccine studies, either those phase 3 trials or what we call vaccine effectiveness studies, starts to show an increase in infection after vaccines. And so if you've been vaccinated and we now start to see an increase in infection 12, 16, 18 months later, that's an indication of when you need to get a booster. The other work that's going on is to try to determine, is there a blood test that we can run on an individual that will allow us to know that their immunity has waned to a point where they're susceptible. And so trying to define the determinants of immunity through a blood test, maybe studying antibody levels, maybe studying T cell activity, that's really kind of the holy grail, is to be able to say, okay, I can do a blood test and say you need a booster or you don't. That work is coming, but I don't anticipate us giving booster shots anytime soon because we just don't have the data that it's needed right now. And I would hate to be giving vaccines to people that don't necessarily need them when we could be giving vaccines to people across the globe that could actually prevent transmission and save more lives. And so that's a work in progress. And I suspect that this is going to be a continued area of focus of research for the months and years to come. If a new variant came to the US that required a new vaccine, that would be a different story altogether. But so I think right now we're in a watch and wait standpoint. We're doing studies here locally and really monitoring that closely.
I want to talk a little bit about some recent news reports that have been coming out around heart inflammation. Specifically, I've seen reports around young men, but we were talking about this and you mentioned it's not just men that are getting this in relation to the COVID vaccine. Can you give us information about what's happening, if it's an alarm that we should be thinking about, or just general information about what's going on?
Right. So what you're seeing is an association between the messenger RNA vaccine, so the Pfizer Moderna vaccine, and development of either myocarditis or pericarditis. So myocarditis is inflammation of the heart muscle. Pericarditis is inflammation of the sac around the heart. And after the vaccine, and particularly after the second dose of the vaccine, we've seen an uptick in these types of clinical syndromes in patients that have received the vaccine. The symptoms of this typically include chest pain and shortness of breath. Sometimes this can mimic a heart attack. It should be noted that this type of inflammation post-vaccine has been seen with other vaccines. It's not unique to the mRNA vaccines from Pfizer and Moderna. We've seen this in other vaccines as well. Smallpox, as an example, is a vaccine in military recruits that we saw a pretty big uptick in this. And so this isn't necessarily unique to this vaccine. Fortunately, the people that have had this, it's been relatively self-limiting and they've done well from it. And so it is a very rare complication. Think of this as kind of like the rare complication we saw with the J&J vaccine in terms of the blood clots. Affects a very, very small group of people. But when we compare the rate of this pericarditis or myocarditis in the general population, we do see an increase in those that have gotten the vaccine. And so I would say that's real. And this is also a testament to our safety monitoring systems of our vaccines. That said, you have to compare risk, right? So the risk of getting a vaccine and having this very rare adverse event that typically is self-limiting versus the risk of getting COVID and having a severe adverse reaction due to that. The risk of getting COVID and severe complications, it's much greater than the very small risk of the vaccine causing pericarditis and myocarditis. So at this point, it's something we watch, we're carefully monitoring, but we still are highly encouraging everybody to get the vaccine because of its incredible impact on effectiveness in reducing hospitalization.
I mentioned earlier that we are currently at 49.1% for those who are 12 plus for fully vaccinated. Is this a good percentage of the state who's currently vaccinated? Do we need to be higher at this current moment in time? What are your predictions for how we're doing on that?
Yeah, compared to national levels, we're kind of in the middle. We absolutely want this number to be higher. And so we absolutely want that number to keep going up to get more and more people vaccinated. 50% of people that are eligible is great. And the higher we get that number, the lower amount of cases, the lower amount of hospitalizations, the lower amount of deaths we'll see. But we're not going to get to a point of herd immunity at 50% vaccinated. That's just not possible. And so we're going to continue to see transmission. And until we get that level up to 85% thereabouts, we're still going to see continued transmission of COVID-19. So yeah, absolutely, we want that number up. I think we can continue to do better in terms of that. What I think has happened is that the people that have wanted the vaccine, has been eager to get the vaccine, have now gotten the vaccine. And so that was, in some respect, the easy part. Now we have to really get that vaccine to those people that are questioning it and really want to talk about the side effects and the benefits to them and the benefits to their family. And now, as we move vaccination into pharmacies, as we move vaccinations into clinics, into primary care practices, that's where those discussions are going to be had. And that's going to be where patients can have that discussion, that dialogue with the primary care doc to say, hey, is this right for me? Can you answer my questions? I'm a bit hesitant about this. And that's where we need to have those conversations. And that's where we're going to be able to push those numbers up. I think what's been fascinating is that the effectiveness of these vaccines has been so consistent across so many different studies that we're getting really comfortable in the fact that this vaccine reduces hospitalization by 90%. It reduces ED and urgent care visits by 90%. There is no subtlety on this vaccine. This is a very good vaccine that really reduces symptomatic disease and asymptomatic disease. And that's really been nice because that's a consistent message we can spread to our communities.
You just mentioned hospitalizations, and we actually got a question around that. Someone was made a statement around how hospitalizations seem to be up a little bit while deaths are way down. Can you tell us in general terms if there's a trend in ages, genders, or any demographics in those who are currently hospitalized? Do they generally have pre-existing conditions, or is it a random sampling of people who are currently hospitalized?
Yeah, I don't have the specific numbers. That being said, this is data that we're looking at, pretty extensively to kind of really understand who are these people being hospitalized and why. And the state actually released, some data and showed that really since March 24th, so if you're looking at the cases from March 24th to May 28th, that of those people that are hospitalized for COVID-19, 95% of them were unvaccinated and 5% were vaccinated. And so that's a time period where vaccination was available, right? And so 95% of the hospitalizations were in the unvaccinated versus 5% in the vaccinated group. And many people in that vaccinated group could be not fully vaccinated, or they could be people that didn't respond to the vaccine, they're immunocompromised, et cetera. We've also seen people that have come into the hospital and tested positive, but don't have symptomatic COVID-19. And so it's really a mixture of people for that. But by and large, the people that are coming into our hospitals with COVID-19 are the unvaccinated population, 95% of them. The other thing that we're seeing is that plenty of people put off healthcare for about a year. And so our hospitals are full with people that have medical illnesses, surgical illness that went unintended for a long period of time and now have gotten to the point where they're severe enough where they need hospitalization and medical attention. So that's also filling our hospitals as well.
Another question that's slightly tied to COVID, but a little bit more to the wildfires that are happening right now in relations to masks. Someone wanted to know if the masks that we've been wearing throughout the pandemic, and I don't know if you know the answer to this, but can protect us from wildfire smoke. I know there was some discussion around this last summer when this was happening, but do we know anything more about whether the masks we've been wearing for COVID will protect us against wildfire smoke?
Yeah, I can't speak to the particulate matter of wildfire smoke and how it relates to surgical masks, but I would anticipate that smoke has large particulate matter that can be filtered by masks, and so I would think that there probably is an association with protecting one's lungs by using a mask in times where we have bad air days and high levels of smoke. I mean, you've seen this back in inversion days and in the winter, and people out and about wearing masks for that exact reason. So I suspect that there is likely a correlation there, that mask use does protect you from a lung health standpoint in times where we have high wildfire and poor air quality days.
Along those same lines too, we've also been seeing an increase of normal vaccines, normal meaning like outside of COVID, in the last little bit. Is there a reason for this? And if it's happening so frequently, what are those viruses that we're kind of seeing start circulating back in the atmosphere? Yeah,
so we are seeing an uptick in kind of what we think of as normal respiratory viruses. So viruses like RSV, things like seasonal coronavirus, rhinovirus. These were viruses we didn't see this past winter. Usually in the winter, you see these levels go way up, and you're seeing RSV and rhinovirus and seasonal coronavirus, and those are the things that cause common colds. Those are the things that cause bronchiolitis in children. We didn't see that at all during the winter season, and that's because we were social distancing. That's because we were wearing masks, and it's because we were washing our hands a lot. Now what we're seeing is RSV is ticking up. We're seeing seasonal coronavirus tick up. We're seeing rhinovirus tick up. And these are things that are causing the common cold. And we're seeing that most likely because people are mixing again. People are not wearing masks again, and we're seeing viral transmission. And it shows that, yeah, we can spread viruses when we kind of take our guard down. The difference is we don't have vaccines against RSV, seasonal coronavirus, rhinovirus. Like that's not one of our tools to protect ourselves from the common cold. We just don't have the vaccines, which is different than seasonal coronavirus. So yeah, it also makes the diagnosis harder because we know that COVID-19 can cause a run-of-the-mill respiratory tract infection that looks like a cold, or it can cause severe illness and pneumonia in somebody on a ventilator. In the winter, we knew that if anybody had a respiratory infection, that was COVID-19 until proven otherwise, and that person absolutely got tested. Now, if people have a cold, that could be coronavirus, that could be rhinovirus. And so it really emphasizes the fact that we need to continue to do testing in people that are symptomatic. Even if you think it's just a regular cold, you still need to get tested for COVID-19.
Speaking of testing, this is a good place to just tell people, our curbside testing is going away as of, and I can't remember the exact date. I'll find it and post it in the comments for everyone. But our testing process is changing a little bit. We'll put more details out for everyone, but the testing process will not just be our drive-up curbside testing that we used to have. To Eddie's point, there are not as many people who are needing testing now. So we're seeing a decrease in the need for those curbside testing. So we'll put out some further information about that just so the general public has that on hand. The last topic I want to talk about is our visitor guidelines for our hospitals. These are changing as of Monday, June 15th. And I want to talk through what those new guidelines specifically are. Do you mind giving us just a general overview of what some of them are, and then we can get to some specifics as well?
Yeah, and so, as we think about our hospital-based restrictions or healthcare restrictions, these need to evolve as the pandemic evolves. And so as we are seeing improving case counts, as we're seeing increase in vaccination, we also need to relax some of our guidelines. However, our main focus, our primary focus is keeping our patients safe and keeping our caregivers safe. And so you will probably see that we are going to go slower than other businesses and other organizations across Utah and across the U.S. is that healthcare is going to go slower than everybody else. And the reason is that we have very compromised patients. We have patients that are at high risk. We have patients that can get a vaccine but may not respond to a vaccine because of the medications that we're on. And so our primary goal is to keep our patients safe and our caregivers safe. We can't care for you if we are sick, and that is going to be our primary goal in kind of pulling back on restrictions. So I just urge the community to understand why we are going slower is really to keep our patients safe and keep our caregivers safe. And there's been plenty of people that say, I think you should move faster. We're reluctant to do that because the risk to our patients is real. The risk to our caregivers are real. The ones that are taking care of people that are coming in that have potentially have symptomatic COVID-19. We'll get there. We'll move in that direction, but we're going to be slower than the general public. And that reason is just everybody's safety. That being said, we are relaxing a little bit as we move forward. 2 visitors at a time will be allowed at the hospital bedside in most situations. There's going to be some restrictions to that in specific units that will be talked about when people get admitted to the hospital. Children aged 12 years and older are now able to be visitors, not just 18 and up. Keep in mind, all visitors will still need to wear a face mask when they come in the facility. If they don't have one, we'll give you one, and still encourage to do hand hygiene. There's no way for us to validate vaccination status and people coming into our hospital. And so for the safety of our patients, the safety of our caregivers, we're going to ask everyone to wear a mask. If you don't have one, we'll give you one. And we really appreciate everybody doing that just for the sheer safety of other people. Obviously, people that, have COVID-like illness, we're going to ask them not to come in to the hospital as visitors. And the other thing is there's no longer a general limit on the number of hospital visitors for patients that are at the end of life. We know that's a really important time for families to gather to say goodbye to the loved ones, and we want to make sure that we can do that safely, and that'll be kind of facilitated by our ICU staff that can do that. So these are a step in the right direction, and we'll continue to loosen these as we monitor the pandemic and as we see things improve. But we're going to be a bit slower than everybody else, and that's okay, because our intentions are there to protect patients and our caregivers.
And something else I just wanted to add, that two visitors at the bedside, the difference for that now is that it's not two designated visitors. So if you had, if you're having a baby and you had mom and husband or spouse attending, you could also have mom switch out with sister now, or something to that effect. So you can switch out people now, and our website will be updated to kind of give the public more information on how that'll work, and just this is all written out there. And that website for everyone is intermountainhealthcare.org/visitors. A question for you around that we got, and you kind of touched on this, of just the fact of us not opening up too soon or loosening too much. Do you have any concerns at all that as we do loosen these restrictions, that we could potentially put patients at risk?
Yeah, that's what keeps me up at night. That's what makes me really concerned and worried. And it really is a delicate balance of, pulling back, but also making sure that our patients are safe and our caregivers are safe. I think the way we're approaching it right now is safe and will be effective, and will allow a little more flexibility with our visitors policies. But that exact point is why we go slow. That's why we're really cautious, and we're very methodical about how we do this, and we really consider all options. And that can lead to some frustration in people that want us to move faster. But the intent is exactly that, is to make sure that we're not moving too fast, that we're endangering patients and caregivers.
Eddie, is there anything else you want to mention to us around the vaccine or anything related to COVID before we take off for the day?
No, I think now's the time to, really emphasize the importance of vaccination. Especially as we're seeing outbreaks in Mesa County, just next door. We're still vulnerable. We're still susceptible. And I think have a conversation with people that haven't been vaccinated, have an empathetic conversation, learn why they aren't being vaccinated. Don't judge them for not being vaccinated, and help them in the process, and help them learn and make that decision for themselves. This is the time where we really need to have those conversations with those people that aren't vaccinated to understand why, and help them along that path. And those that have been vaccinated, thank you for doing that. Thank you for helping protect our community and yourselves, and engage people in conversation about it. And no judgment, just understand where they're coming from, and help them with information.
Well, thank you so much for all of that great information. And if anyone is watching who has not received their vaccine yet, you can learn more about them at intermountain.com/COVID vaccine. Our vaccine clinics are through our pharmacies now, as well as specific clinics that are happening throughout the state. Primary Children's has a vaccine that you can just walk up clinics happening today until 5 p.m. and then next week, Monday through Friday. I will post the specific hours for next week on there as well. But again, Dr. Stenehjem, thank you so much, and have a great day.
Thanks, Amanda.
Thanks.